Good morning, everyone. My name is Vaishnavi Ramshandare, roll number 103, and I will be presenting on the topic of countercurrent mechanism in urine concentration. Countercurrent mechanism is a system in which inflow runs parallel and in close proximity but opposite to the outflow. This mechanism consists of two systems, countercurrent multiplier and countercurrent exchanger. The primary function of loop of Henle is to determine the osmolarity of urine using countercurrent multiplier system. The osmolarity of the interstitial fluid in the medulla must be high, whereas the osmolarity of the tubular fluid must be low to concentrate the urine. The countercurrent multiplier system achieves this. The countercurrent multiplier system consists of a loop of Henle of nephron. It established the hyperosmolarity of medullary interstitium by repetitive reabsorption of sodium chloride by the ascending limb of loop of Henle and reabsorption of water from the descending limb of loop of Henle. Causes of hyperosmolarity of interstitium of medulla is due to the osmotic fluid from PCT, active transport of sodium chloride and other ions from the ascending limb of loop of Henle into the medullary interstitium, thereby forming the hyperosmolarity in the medullary interstitium. Due to the concentration gradient, the sodium and chloride ions diffuse into the descending limb of loop of Henle, once again reaching the ascending limb of loop of Henle through the hairpin bend. These ions are repeatedly recirculated in the loop of Henle through the medullary interstitium. Reabsorption of water from the collecting duct further concentrates the urine. This system is wholly known as the countercurrent multiplier system. The other factors related to the hyperosmolarity of medulla are reabsorption of NaCl from medullary part of the collecting duct into the interstitium, recirculation of urea, reabsorption of water from DCT and collecting duct by the action of ADH. So now the countercurrent exchanger system. It maintains the hyperosmolarity of the medullary interstitium, which was previously established by the countercurrent multiplier system. It consists of vasa recta, which is U-shaped. The vasa recta is formed by afferent arteriole, which is the blood supply of the nephron, which forms the peritubular network surrounding the loop of Henle. The blood supply is very low, sluggish, and in very close proximity to the loop of Henle. Here are some special features of the renal medullary blood flow. The medullary blood flow is low but helps in minimizing the solute lost from the medullary interstitium. The vasa recta serves as countercurrent exchanger, minimizing the washout of solute from the medullary interstitium. It is important to remember that the vasa recta do not create the medullary hyperosmolarity, but they do prevent it from being dissipated. As we can see in this picture, the reabsorbed ions are absorbed in the vasa recta and hence recirculated. This is how the medullary interstitium's hyperosmolarity is maintained. So, in conclusion, the countercurrent mechanism is a vital physiological process. Its dysfunction can have significant clinical implication, making it crucial aspect of kidney function in patient care. Thank you.